The evolution of Michael Jackson's face over the years continues to fascinate fans. And while the reasons behind many of those changes may never fully be revealed, the September issue of Allure magazine has some theories. Kristen Parada is the magazine's editor. Kristen, good to see you.
Thank you. Thank you for having me.
Well, you know, a lot of people point to, I guess, 1981 as the beginning of this transformation of Michael Jackson. What happened in 1981?
In 1979, Michael Jackson suffered a huge fall during a concert and broke his nose. And this was the beginning of the plastic surgery. And what we wanted to look at as a magazine was a lot's been talked about with his appearance. His appearance was as important to his performance as his music.
Sure.
Yet, people always sort of dismissed the oddities of his appearance to body dysmorphic disorder. And we wanted to look at, were there other issues? And we found that there were a series of medical issues that really did influence his style, the way he dressed, the way he looked. So you can see from 1981 he gets his first nose job, but when you go to 1983, he has a revision of his nose job, which is very common.
And when you say revision, what did they do?
They basically narrowed his nose a bit more, and this is something that is 20% of all patients have this. Now, when we spoke with his doctors and people in the offices, you know, a lot of speculation has been made about how many nose jobs, nose surgeries did he have.
He only admits to 2.
Correct. Now, we had some doctors who look at pictures, they say it looks like he has 20. No one knows for sure, but we did come up with, the doctors had an interesting theory as to what may have caused his nose to continue to change. We will get to that picture.
Okay, but in 1984, there was another change. This time it was his hair, and it was a pretty publicized reason for that.
Right. When Michael Jackson was filming the Pepsi commercial in 1984, his hair caught on fire. But what people don't realize is that he did lose a lot of hair in this. He suffered major scarring on his scalp. He started wearing wigs and hats, so this is where you see his look start to change. And he also had to undergo a number of very painful surgeries on scar revision for years to come.
Could this have been really, in a sense, the most transformative issue that happened to him? Because it sounds like this was extremely painful, and when we recently saw that video from behind when it happened, it was probably extremely traumatic.
Right. I mean, the sources we spoke with, I mean, they definitely indicated this would have been very traumatic for anyone to go through, never mind someone who's in the spotlight.
And when you're talking about scalp revisions, I mean, that's got to be pretty painful.
It is painful, and it's a number of surgeries over a series of years.
Then, okay, 1986, there's a really dramatic change here.
Yes. In 1986, you start to see that he has tattooed his eyebrows, his lash line, his hairline, and what's happening, the doctors explained to us, is that Michael was, not only had he suffered the burns, but he is now diagnosed with lupus, which can cause hair loss, and also vitiligo, which causes unevenness of the skin. Yes, exactly. So one of the treatments is to, you know, of course, disguise the hair loss with tattooing, and then also to start using hydroquinone, which is a bleaching agent, which can even out the skin.
To even out the skin. So the paleness could be the result of this drug and pale makeup.
Right. It could be a combination of both. There's a lot of possibilities. But these are things that, you know, you and I don't have to deal with.
When you're talking about, you've talked with doctors, are these actually Michael Jackson's doctors?
Yes. We spoke with Stephen Hofflin, who is his longtime plastic surgeon, Arnold Klein, nurses and staff from their office, and then a number of other doctors who had worked with these teams.
1987, again, another difference here.
Okay. 1987 is where you really start to see his nose changing. It's a lot thinner. The tip is raised. And where some people might say he had more surgery, what the doctors did say to us is that they suspect he was actually getting injections of a steroid called Kenalog. And what Kenalog does, it's a steroid that's sometimes used in the nose to decrease scar tissue.
Isn't this a very painful procedure?
It's incredibly painful, and patients are typically put under with using Diprivan, which of course has been implicated in Michael Jackson's death, but it's a very, very painful injection, and if you get it over a series of years, which most people would not do, it can really cause your nose to shrink, and it also can thin the skin.
The controversy, of course, the color of his skin, we really start to see him lightening from 1990 on into 1996.
Yes, and this is the doctor, our sources said, you know, could be a combination of the makeup, but also the fact that there could be bleaching agents used because of the vitiligo. I mean, if you do notice, we spoke with a friend of his who did say that if you notice, Michael is always wearing long sleeve shirts
High
and
collars.
high collars. It could be because with vitiligo you have a sort of speckled appearance.
There's a picture here of him from 2002. A lot of people think, the word we've always heard, his nose was falling off, that he had a prosthetic nose or something like that.
Right. Our sources said his nose was not falling off, and in fact, in this picture, which was very famous, what he has on his nose is actually paper tape, which is used patients wear it for a week after rhinoplasty. So he could have had a revision of his nose.
So sad to look at. And then in 2009, it's just almost skeletal.
Yes. And now this is something Michael he's very gaunt, and it could be a result of weight loss, which we do know he did lose a considerable amount of weight. Of course, we also lose a lot of fat in our faces as we age. And so what Dr. Klein admits is that he was giving Michael Jackson Restylane, which are filler injections to help fill out the face. But it looks a little uneven, and that could be because of a thinning of the skin from the Kenalog.
Yeah.
It's just he had a lot to deal with being such a public figure and having all of these medical problems that would be challenging for anyone.
Very difficult to see. All right. Well, Kristen Parada, thank you so much.
Thank you.